Area health providers say the changes are unknown after President Trump signed a budget bill last week. One thing in question, how cuts to Medicaid funding could impact those seeking health care. Take a look. This is data from Medicaid.gov. In Missouri, more than 1 million people are signed up for Medicaid and CHIP services. Kansas, more than 413,000, and more than 979,000 in Oklahoma. KOAM's Ty Park spoke with Kansas Senator Roger Marshall and local health providers.
We just don't know. Our patients rely heavily on Medicaid, so obviously we're very concerned and we're trying to look into the facts, but we just don't have the information, the data right now to know how is this going to impact Missouri and where the change is going to be.
Stephen Douglas handles the media and public relations for Access Family Care in Missouri. He says a lot of their patients are on Medicaid. On the 4th, the president signed the One Big Beautiful Bill Act into law. It includes over $1 trillion in cuts to Medicaid over the next decade. Supporters of the bill, like Kansas Senator Roger Marshall, says despite the cuts, Medicaid will still be there for those who need it.
We're protecting it. We're saving it for those who need it the most. This is something I've been working on since New Year's Eve when I sat down with Dr. Oz and kind of made a plan going for the future. But we're going to make sure that seniors in nursing homes, people with disabilities, children, pregnant women, we're going to make sure that they have Medicaid.
Hospitals and other healthcare providers in the 4 states are taking a more cautious approach and say much is still in the air. Mercy released this statement, saying in part, caring for those in need regardless of their ability to pay has always been the heart of Mercy's mission. Cuts to Medicaid are a serious setback to our patients and to every American. Not only can this lead to longer wait times in the emergency room for everybody, but it prevents patients from addressing underlying or chronic needs. And it puts an even greater financial burden on patients, hospitals, and the U.S. economy. For those Access Family patients who think they may be on the chopping block, Douglas wants them to hold on for the next 12 months.
So we're going to do all we can to serve them and to advocate for them, and we're going to be right by their side through all of this.
Ty Parks, KOAM News.
Freeman Health System has released a statement saying they are committed to provide high-quality, compassionate care to everyone they serve. And Freeman is also committed to supporting patients eligible for Medicaid and assisting them through the enrollment process.